So, I will explain to you in brief about robotic surgical system, the Da Vinci system which we have here. So, basically all robotic surgery has three components. Okay? Among the three components, what you are seeing that side is the vision card, where everybody else will see what is happening in the surgery, and this is called the patient card. Okay? This patient card has what you call as robotic arms. These are called robotic arms. Okay? So, and that is called the surgical console or the surgeon's console. That is the surgeon's console. Now, how this whole system works? So, the patient is lying on the table and the patient is under anesthesia. These are the ports. Okay? These are the only thing which is actually going into the patient's body. If we are operating on the abdomen, these go into the abdomen, like create small holes on the abdomen. The diameter is only 8 millimeters, very small holes. So, they do not require extra sutures to prevent hernia because in these ports what we are using. And these ports are connected to these arms like this. And this whole cart is brought closer and only these arms are moved like this, and they are brought closer into the patient's body. And the whole thing, you can see that it does not move when I am not asking, only if I press the control it will move. Now, once what we call as docking is done, this whole system is fixed here, and then we move to the surgeon's console. The surgeon sits here and we look into this vision system. So, I sit here and then I look into this, and then I am seeing the operative field, what is happening inside the patient's abdomen. And these are the controls what we have. I have 2 controls on my hand and few controls on my leg, and with these 4 controls, with the permutations and combinations, I will do movements here. So, these movements are translated into the movements of those ports. So, once we do the movements here, those are translated into the movements, the very fine movements of that what is happening inside, and these fine movements lead to the surgical movements of the instruments inside. This system works so efficiently that if I move even 1 millimeter away from the console, like for example, I am sitting here and I am operating, and somebody calls me, or I just need to bring my head out, then the whole system freezes completely, meaning it does not cause even 0.1 millimeter movement of the arms. Wherever they are, they stay. So, that means this robo is completely under my control. It does not move a little bit also by itself, and whatever I tell, it does. So, it all depends on how the surgeon does the surgery, and that results in the movement of the arms, and hence the safety is ultimate. It is so ultimate that even in open surgery, sometimes when we are seeing or when we get distracted, our hand movements can cause a little bit of extra movement. But in this robotic surgery, it does not cause at all, because the minute our vision is slightly away from where it has to be, that if I move from here, it freezes, and that is extreme safety. And the controls, the cautery system, the cutting, the precision, it's ultimate, because the vision what we see here is almost 20 times. It's much more than what we see in a regular laparoscopy, and so it is in a big zoom. And when my head is buried inside this, I feel as if I am actually looking very deep into the patient's abdomen or the operative field, and hence I am having lot of freedom of operation over there. Even subtle movements can be done very nicely, because of which there is no collateral damage. That means if whatever is the work I want to do, I can do it so nicely that no extra damage to any tissue there, and hence the chances of injuries are less, and chances of extra suturing, extra work there. So, usually people have pain when there is lot of dissection there, or lot of suturing there, or lot of cutting of skin or the external structures. Since the cutting of skin is extremely less, I told you it's only 8 millimeters port. Even in many laparoscopic surgeries, we use a 10 millimeter port. So, the rule is if you use a 10 millimeter port, you have to take a stitch on the rectus sheath to prevent a hernia. So, that stitch can cause more pain to the patient. Even that much pain also is minimized. And inside work what we are doing is also it's so good that overall the pain component is very less, the chances of injuries is very less, chances of bleeding and complications because of that is very less with robotic system, and hence this new added technological support to our expertise as surgeons has a lot of value addition in giving the best patient care and best outcomes to the patients, even in cases of very complex scenarios like multiple previous surgeries, huge masses in the abdomen and difficult scenarios like that.